I'm Dave Sheehan, presenter for Connect. In our next episode, Aubrey Gowing will review what is plantar fasciitis, and we'll also have some great tips on how to treat the condition. Then I have a chance to catch up with the Athol Robinson Award winner for 2020, Louise Manka, who as part of her award will gain 12 months of mentoring from industry leaders. I hope you'll join me for our next Connect.
Plantar fasciitis. Is it an inflammatory condition? Is it inflammation of the plantar fascia? Well, the name would suggest that this is an inflammatory condition. Yet studies have shown that there's rarely inflammation present, and certainly not after the first acute occurrence. Oftentimes we see images like this that shows tearing and rupture of the plantar fascia. Yet Paul Ingram, a science writer for painscience.com, said this in a very informative article. He said the itis suffix in tendinitis and fasciitis means inflammation. Many people are afraid of running. They're particularly talking about running in this article because between 30 and 70% of runners get injured each year, with quite a high proportion of them complaining of plantar fasciitis. But the tissue is rarely inflamed. Not in the way that we usually understand it anyway, so it may be at first, but certainly not for long. These tend to be the acute phases when injury will occur. Instead, the plantar fascia shows signs of collagen degeneration and disorganization. In other words, scar tissue. So let's take a look at some of the structures involved here. What's usually referred to as the plantar fascia is actually the plantar aponeurosis, which is a thickened band of connective tissue which supports the arch of the foot. And functionally here really it's like ligament because it's connecting bone to bone. So the aponeurosis is the central part of the fascia, and then it has slips that extend onto the metatarsals. The medial plantar fascia then is just part of the general superficial connective tissue. And then the lateral plantar fascia is again just continuous with the surrounding connective tissue, and it covers the lateral area of the foot. And the most common site of pain then is just on the medial aspect of the calcaneum, shown here pulsing in red. So muscle tension in the calf, particularly coming from soleus through the Achilles tendon here, will pull the calcaneum or heel bone backwards, and this will place additional stress along the aponeurosis, causing tension and pressure on this point of attachment, which is our common site of pain. In 2003, Lamont did a study looking at 50 cases and found so little inflammation that they declared that plantar fasciitis is a degenerative fasciosis without inflammation, not a fasciitis. So it would be better to use the more common or more generic suffix like opathy for diseased or osis for condition. Such degeneration is similar to chronic necrosis. So this is like cell death that we see in tendinosis, which features loss of collagen continuity, so a breakdown in the collagen fibers, and an increase in the ground substance of the fluid in the area. This is the matrix of the connective tissue. And an increase in vascularity and the presence of fibroblasts. Fibroblasts, remember, are fiber builders, rather than the inflammatory cells usually seen with acute inflammatory conditions like tendinitis. So what causes or what is considered to cause plantar fasciitis? Well, excessively pronated feet or low arches or flat feet, which we see here. There's almost no arch in this person's foot. But equally, they blame excessively high arches on being a possible cause of plantar fasciitis. Repetitive load or long periods of standing. So you can imagine the stress that's being repetitively put through the plantar fascia, particularly during this toe-off phase. They say that it can be the equivalent of up to 180 kilos of pressure just on this plantar fascia during this toe-off stage. Muscle tension. This is one of my recent clients, and they had a tightness in the inverters of the foot, particularly posterior tibialis. And this is after 2 to 3 minutes of therapy that the foot position, the heel position had normalized quite a bit, and this is someone who is a regular runner. Bone spurs are considered to be another common cause, but plenty of people have bone spurs and yet don't have any pain. There does seem to be some correlation between the type of pain people get with plantar fasciitis and the presence of bone spurs, but it's not always coexistent. These bone spurs are oftentimes considered to be very soft, that they're not really true bone. Again, they've been compared to, let's say, comparing these spurs to bone is like comparing tinfoil to sheet metal. That really these are quite soft and can be oftentimes broken up. We also see then if there is weakness in the stirrup system. So the stirrup system consists of 4 different muscles that is providing lateral support to the foot. So we have anterior and posterior tibialis providing support to the inside of the arch, and then the peroneal muscles or fibularis muscles providing support to the outside. Dysfunction in these will cause excessive stresses through the foot, displacement of the bones in the joints or lack of centration. They're not dislocated or even subluxated, but they can be out of position, lacking centration. So when there is arch dysfunction, we see that there is an imbalance between these 4 muscles. The effect then, it causes pain mainly in the arch of the foot, mostly around the heel and particularly on the medial aspect of the heel. And the symptoms are most pronounced in the morning. So a lot of people find when they get out of bed, there's a very sharp stabbing sensation. And this is quite a good visual, I think, for what most people would experience. They oftentimes say it's like stepping on glass when they first get out of bed in the morning. And this can be partly due to the fact that the feet are in a very plantar flex position, either from the weight of covers resting on the feet, or if the person is lying face down, simply that the feet are arched backwards. And overnight, they would say, because body temperature is dropping a little bit, tissue tends to cool, it'll tend to become a little bit more rigid, some of the fluid will be reabsorbed from the area, but also more adhesive processes can take place. When you go to suddenly lengthen the plantar fascia by weight bearing, that can add additional stress and cause the pain to be quite acute first thing in the morning. So it can be continuous throughout the day and night. And a lot of people actually find they have difficulty in sleeping, that the pain can be quite intense during the night. Pain can sometimes be experienced during initial activity, but then can reduce when the activity is continued, because the warming up of the tissue will sometimes increase the pliability of the collagen within this plantar fascia. Associated tightness of the Achilles tendon is common as well, and we'll talk about that in a little while. Researchers used ultrasonography to show that people with plantar fasciitis have a thickened connective tissue, particularly in the bottom of the feet. So if the plantar fascia has experienced repetitive strain, the body will oftentimes respond by laying down additional collagen fibers, and this is that excessive fibroblast activity that can sometimes occur, building extra collagen fibers in response to the tensile stress experienced by the plantar fascia. So how do you test for plantar fascia? A positive test would be dorsiflexion. If it's primarily fascial, the foot is stressed, or you can increase the resistance by bringing in a resisted plantar flexion, which is going to pull on the tendinous attachment. So as the client tries to push their toes towards the ceiling, so gastric is relaxed with the knee bent, they're tensioning soleus and a little bit of posterior tibialis, and this will pull on the heel and increase the length or the stress in this area between the heel and the base of the toes, or between the calcaneum and the metatarsal heads here. So it's generally treated as a strain or sprain. Most people would actually consider this to be more like a ligament because it is connecting bone to bone. Our first intent would be to reduce the excessive tension that we may find in gastrocnemius, particularly in soleus, and almost certainly in posterior tibialis. A resisted test should then be performed again because sometimes there is just simple ligament pain. This area is painful because of the amount of stress being placed upon it. There isn't any disorganized collagen, there isn't anything else, anything more complicated, and that's why it's considered simple ligament pain. Not that it's not painful, it certainly can be, but once the tension is taken off these tissues, the issue may resolve. However, if it doesn't, if there is some disorganized collagen, some scar tissue in the area, when the repeated test is performed, the client will point to the area that is affected. So a multidirectional friction will be applied for 30 to 45 seconds, and this is done quite gently. It's strong enough to have an effect, but gentle enough to be pain-free. And that's an important point. If it's too light, you're not getting down to the disorganized collagen and can't free up that collagen matrix by working those fibers to separate adhesion between them. But if it's too forceful, it can irritate the tissues, and that will be counterproductive. This simply softens the collagen matrix. It is actually movement that rehabilitates the potential scar tissue in this area. So the client performs active range of motion, and this must be pain-free. And then eccentric loading is performed. At the beginning of this video, we looked at the potentially inappropriate terminology that's used in plantar fasciitis and concluded that it's not an inflammatory condition. So, therefore, the use of anti-inflammatory medication really is not indicated. Where movement is essential to really rehabilitate the scar tissue in the plantar fascia, devices that restrict range of motion can really only be considered useful in the initial acute inflammatory phase. And while stretching is important, we have to understand how to stretch specific. Exercises that lengthen the calf muscles against resistance while they're tensing or under load really prevent effective stretching. Because the muscle is tensing, it's resisting. Weight-bearing movements like the one shown in this image is actually a really good way to strength train your calf muscles, not to stretch them. And in this next image, this even suggests that you can stretch your Achilles tendon this way. Interesting concept. To effectively stretch a muscle, it really must be relaxed, or better still, neurologically inhibited, because that means you're contracting the opposite muscle, or the antagonist, and helping to relax the target muscle, the one you're trying to stretch. Therapist-assisted stretching can be used in the treatment session to show the client how to effectively stretch and differentiate between distal calf muscle stretches and proximal calf muscle stretches, so how to target each end of the muscle, whether it's gastrocnemius or soleus or any of the other calf muscles. And most importantly, you can demonstrate stretching of pennate fibers of muscles. So standard stretching routines focus primarily on the principal longitudinal fibers, but they neglect these all-important stabilizing and oftentimes tight pennate fibers. These can be effectively targeted by simply changing the angle of the stretch, in this case by inverting or everting the foot as we dorsiflex. With the knee flexed to 90 degrees, soleus can be effectively stretched using the same method that we invert or evert to target the pennate fibers of soleus, either the medial fibers or lateral pennate fibers. To maintain the effects of treatment, it's important that these exercises are practiced regularly. At home, something like a stretch strap or even something simple like a towel can be used to provide assistance. Oftentimes the antagonistic muscle may not be activating enough to get full range of motion, and a gentle increase in load by gently pulling on the stretch rope can help achieve full range of motion and help really increase the effectiveness of these stretches. 2-second holds and moving in and out of the stretch position also helps to prevent ischemia from developing. And ischemia is one of the primary things that will cause irritation on nerve endings and can develop into trigger points. Hope you enjoyed this short video and found it helpful. If there's subjects you'd like to see us cover in future videos, particular injuries or explanations of anatomical structures, please do get in touch with us either by leaving a note in the comments or you can email us at info@hcd.ie. You can also find information on our training seminars as well as our resource materials such as DVDs and books on our website. It's hcd.ie. If you'd like us to travel to you to provide a seminar in your area, please do get in touch. Thanks for watching.
Have you accessed Halo, Massage and Myotherapy Australia's health and learning online platform? Halo is the association's portal for online learning modules and is a great way for therapists to earn CPE points. There are a full variety of courses available on Halo, including theory-based development modules such as ethics, professionalism, law and business advice, as well as more technical modules that cover specific modalities and techniques. Be sure to check back regularly for newly added modules. Halo is also where Massage and Myotherapy Australia members access the Ethics in Practice mandatory module, which must be completed every 3 years and is free to association members. Halo modules can be purchased through the Massage and Myotherapy Australia website and are accessed through the member portal. All Halo modules are discounted for association members. You can learn more about Halo on the Massage and Myotherapy Australia website, the Association of Professional Therapists.
Hello from Associated Bodywork and Massage Professionals, the leading association for massage therapists in the United States. I'm Leslie Young and I'm ABMP's International Ambassador. I'm so excited about our new partnership with Massage and Myotherapy Australia. Now, MMA members can join as ABMP Associate members at a deep discount and access more than 200 hours of online continuing education and other member benefits. So for more information, visit abmp.com/MMA. Together, we look forward to supporting you and your career.
Hi everyone, Dave Sheen from Connect. Now today I have a very special guest on our show because it's the Ethel Robinson Award winner, Louise Manka. Welcome.
Hi Dave, thank you.
Now, we're just talking about it off air for a moment there, that the actual award, a lot of the members don't actually know what it's all about. So it's an award that's been given every year, and it's a 10-part program, mentoring exposure to the range of support based on the applicant's or the winner strengths and weaknesses. So, did you want to sort of explain a little bit about the process of applying for that, so that the folks at home, or the members at home, can actually maybe follow that through if they're interested in the program? And then we'll go back and have a look at the career of yours and the lead up, because there's a lot of relevance to the actual, I guess, the benefit of winning the award and where you've come from.
Yeah, sure. Thanks, Dave. So the reason I was actually looking through the website a lot. So when I was still studying, I was thinking, oh, it'd be really great to know a little bit about the different associations that are available. And so I spent a lot of time kind of looking through the website, and I stumbled across the Ethel Robinson Award, and I thought, oh, that looks fantastic. And as you mentioned, because of my background, I understand that power of mentoring is fantastic, and I just thought that would be a great opportunity. So part of that process was to fill in an application, and it was, you could do it by video and or a written application, and I chose to do a bit of each. Yeah. And so you had to address criteria such as, what do you see the benefits of the award, how will you promote the award, what are the kinds of things how will it help your career progression, that sort of thing. So that was one part of it, and the other part of it was getting an endorsement from where you studied, and I studied at Melbourne Institute of Massage Therapy, and so Graham de Goldie needed to, talk to the staff there and find out kind of some of the things that I was doing as part of that. And they looked at, your communication skills, leadership, the way you supported other people throughout it, academics, so various criteria. Yeah. And then it was submitted, and a committee of the board of Massage and Myotherapy Australia, plus someone from the Robinson family, get to assess the applications.
Fantastic. Now, a double plug for MIMT. I'm a graduate of the institute as well, it was a fantastic experience that I had with Steve and Graham. So, now let's get back to your career path. Now, quite a nomad.
Yeah.
I mean, I was looking through, you're zipping around all over the country. So, you've got Tassie, Sydney, and Melbourne. Is that all? Or are there other places of career that can be included? But you've done lots of stuff.
Yeah, lots of different things. Yeah, I grew up in Sydney, and then headed down to Tasmania for a few years, and I ended up studying science down there. It was a great place to do zoology, and then moved to Melbourne. So and in different capacity now, but I did. After I was a zoologist, I did that for about 7 years, and then I really, then I started having children. I really enjoyed working with them, and I actually volunteered as a mentor myself at that point in a mentoring program, and ended up coordinating the program, and did that for about 6 years, working with young people and with community mentors. Then ran my own business for a few years, consulting. Got into learning and development after that, and then I actually worked for an RTO for a few years when I moved to for a short time when I moved to Melbourne, and then in the job that I am now as a program manager running structured mentoring programs. So that's 4 days a week. And then last year decided, because I've been a sports person all my life.
Yeah. What sort of sport has been your thing?
I started off with gymnastics, and then netball, basketball, soccer, taekwondo. Okay. I did some triathlons. I did a marathon, lots of half marathons, and now I do yoga, and cold water swimming is what's keeping me sane at the moment. So in the oceans.
Okay, so what you're residing in Melbourne now? Yeah. Yes. Yeah. So a swim in the bay. That's your thing, is it?
That is my thing at the moment. A few times a week. It's brilliant. Yeah. Cold, but brilliant.
Yeah, absolutely. So it's been an interesting progression. As far as mentoring is concerned, what are some of the main takeaways for you, being as far as reward? In the past, you've worked, as you've mentioned, with youth, I think at high schools, but there's also a senior component to that too. So you've worked with different cohorts. What sort of things have really, I guess, the memories of that past? What things did you gain from that?
Yeah, so I've worked with disengaged youth, disadvantaged youth, gifted youth, so a range of different programs. And so I think the most rewarding part is seeing young people get the support that they need. And I mean, the really important thing about mentoring is this awareness that there's something else potentially out there, and then the belief. You know, a mentor builds that belief of that young person to think that perhaps they could change the trajectory of their lives. And then finally, the empowerment piece, which is the mentor then is able to share their wisdom and I like to think share the secrets of how they do that, because unless you've been in a privileged, educated environment, there are so many pieces of the puzzle about how you move along your career pathway that you tend to be taught by the people around you. And if you don't have those kinds of professional role models, networks and support mechanisms, it's really hard for a young person to move along those pathways and change what could be a generational or a cyclic kind of future for them.
Sure.
To see that happen and to see these young people reach their goals and dreams is, you know, it's the most. There's nothing bad about what I do.
Absolutely.
So
I've got a dear friend of mine who I've known since primary school, and he works within the prison system, and his role is integration back into, you know, society. And I was talking to him last night on a little Zoom catch up, and in a similar way, I mean, he it's something that I couldn't do. I don't think I would get really frustrated, but for him, having small wins along the way is it's just gold for him, you know, absolutely gold. So I take my hat off to you. It's fantastic work in that respect. And as I said earlier, you're the winner of the awards. So now it's coming back to you. So I think you've got 12 months of mentoring in an industry that you're probably unfamiliar with to a little moment there in time, and now you're going to move in and have someone hold your hand through for the next 12 months. What actually was the moment when you thought to yourself, "Oh, I'm going to go do massage"?
I think. Okay. So I was saying before, I've played a lot of sport, and it's because of all that sport that I've had a lot of injuries, and I've had surgeries and rehabilitation from various things, and the major one was a torn MCL and ruptured ACL. And so the path back from that was quite extensive, and you know, you have a weakness in one area and you compensate something else, and you've got all sorts of things going on. And so it was through various methodologies, but very much a lot of massage and strength work that I was able to rehabilitate myself. And it was a lot of it was then at that time as well, you know, I'm doing a lot of sitting, and that's aggravating my situation. So I went, I need to do something different. I've always had an interest in this. This is the time to do it. And that's when I thought I'm going to go and do some massage therapy qualifications and see where it leads.
Fantastic. So you graduated last year, is that right?
Yes, yeah, that's right.
So perfect timing, not. So you've graduated and now shut down pretty much. So so that's not so great. But, you know, we're going to come through this and particularly because you put your hand up for external mentoring, I'm sure that you're going to make a great success of your new career. What sort of things, I think on the application, there's talk about wanting to know more about your maybe strengths and weaknesses to review your skill set and see where maybe there might be some deficiencies or areas in which the mentoring could assist you. Is that right?
Yeah, that's absolutely right. So through various conversations. So one of the great things about doing this is that introduction to a whole lot of experienced mentors in the field who have specialised in different areas. So I've talked to Kevin Skillen, who I'll be doing the certified specialist program with.
Great, good plug.
Yeah. It's got so much knowledge. I've had some good chats to Steve Rogers from MIMT as well, including the podcast that they did, and he was a wealth of knowledge. of course, and I meet monthly with Anne Davey, CEO from Massage and Myotherapy Australia, and Steve Westcott as well.
Oh,
so
brilliant.
Great conversations with them. Alicia Crook, I've had a couple of conversations with as well. So at the moment I'm meeting with her monthly, and we're talking about marketing. And then the next area I'll be looking at is, business planning. So actually the nuts and bolts of running a massage business, and I think it's really good to be able to work with people who specifically have experience in that area, and can sort of steer me in a way where I can perhaps not make a whole lot of rookie errors that I quite possibly would make anyway, So, so now for me at the moment, it's like I'm kind of going, okay, what are the really key things that I need to be focusing on? How do I make the most of the Ethel Robinson Award right now? And I've kind of put 3 criteria in place for myself, and it's like, does it give me energy? Does it align with my version of success?
Yeah.
And is it authentic? Does it feel authentic? And because I started to feel like I was getting kind of really wound up in things, and there's only so much I can do at the moment. So I needed a way for me to find some clarity and some in terms of what I needed to focus on. So that feels a lot better.
Okay,
and
that's great.
Being in lockdown is, as we all, what most of us experience is quite stifling. So and you can get in your own head a bit too much.
Absolutely, yeah. So let's talk about lockdown and moving through lockdown. So in 2 years' time, let's assume that we're out there and we're back doing what we love doing. How do you see yourself with your business? I mean, are you looking at a home business? Are you wanting to set up a clinic? Do you want to work for another clinic for a while? What's your take on that?
Yeah, so look, I actually was able to secure some part-time hours in a physiotherapy clinic, Port Melbourne Physio and Pilates, if that's okay. I'll give them a bit of a plug. So when we come out of this, I'll be doing some hours on the weekend. So my main aim, I guess, over the next couple of years is to build my skill set, to really work out what I would like to do, because I don't want to rush into anything. I'm not going to sort of rush out and start my own business full time. That's probably not where I'm going to go, and that's where I referred to that. My version of success is what I would, what's best for me and where I want to go in the next sort of 5, 10, however many years. So I see it as a slow burn, and really identifying those things that will really work towards what I'd like to do in the future. And I'm not 100% sure where that is yet. So working in somewhere like this clinic environment, I'm around, it's multimodal. So they actually have psychologists there as well. So they have physio, they've got Pilates, they've got a dietitian. So it's a really nice holistic, I think, where
great
they're going.
Exposure. Yeah. As an initial,
And then how I might be able to support those modalities with what I'm doing. So, I think a couple of years working for someone else, at least is a really good start to help me, work out how much of it I want to do as well, because I think it's massaging, 25 hours, 30 a week is pretty hard yakka, and I'm not a young chicken. So, I have to look after myself physically as well in that respect.
Absolutely.
And also make sure that I'm sort of getting that mental stimulation and fulfillment as well.
Okay, fantastic. Well, we might leave it there. Ethel Robinson Award, folks at home, if you're interested in finding out more about it, it's on our website, Massage Myotherapy Australia's website. And Louise, is there anything else you want to sort of throw in at the end of the interview for anything? Anything else to say?
Look, just that I really enjoyed studying. It was a really great course. I think it's a great qualification, regardless of what you do with it. It's a good skill to have. So I'd encourage anyone who was thinking about it to engage in it. And also, make sure that you do join some kind of association, because it gives you that credibility, the currency and access to things that you might not otherwise know about.
Yeah, no, for sure. And the actual process, just quickly, applying for the award, that was quite a simple process. Did it take you many hours to raffle up all the information that was required, or was it?
Look, it wasn't too bad because I'd already joined the association. So, because you've got to have your insurance, you've got to have your first aid, which you do in your course anyway, and you had to get a stat deck on your qualifications and things. So, look, not really. If you're organised, which is pretty key, it's not too much effort.
All right, fantastic. Great note to finish on. Louise, it was great having you on board our Connect show for today. And I wish you all the very best in the next 12 months with your mentoring through the Ethel Robinson Award. And no doubt we'll see you around in the industry. I reckon you're a high flyer, so no doubt might try and get you on some committees down the track at the association and or board. We'll see how we go with that. See if we can entice you in. You've got a great skill set.
Thank you. Thanks for having me.
No worries. See you next time, everyone. Bye-bye.